So the third related, the health-related aspect of the MDGs was on HIV, malaria, and TB. You might ask why those three diseases. That would be a good question. But I suppose what you can see in relation to HIV, the big success of the golden age of global health was the amount of funding put into antiretroviral treatment. That's the green line, the numbers of people in poor countries getting on antiretroviral treatment. And as a result, the number of deaths from HIV/AIDS-related causes has been declining, and the number of people newly infected with HIV/AIDS has been declining. But if we look at the global burden of disease overall, of course, the biggest diseases in terms of number of deaths caused worldwide, the number of premature deaths as well, are from chronic non-communicable diseases like heart disease. Where is the global fund for heart disease? I know these are global figures, not disaggregated to developing countries, but I can tell you now that for developing countries as a whole, chronic diseases are the main burden now. Where is the global fund for heart disease? Where is the global fund for stroke? Well, we get long lists of different indicators and different diseases, but is that really where we should be going? In health, we're haunted in some ways by the brilliance of the World Health Organization's achievement of eradicating smallpox in 1979. But this could be done because of the peculiarities of the disease itself and having a highly effective intervention available for it. That's not the case for all diseases and all conditions, let alone, not even just within the realm of infectious diseases, let alone the much more complex chronic and non-communicable diseases. We cannot yet think of ourselves as achieving malaria eradication or HIV eradication. But the idea of focusing on a disease has dominated our thinking. And this is, I'm going to focus on the HIV issue as the key problem here, because we put huge amounts, this is the US government's funding, Help for Health, put huge amount of aid funding into HIV/AIDS as opposed to other health issues. That's been replicated for all donors. That's the golden age, quintupling of global health aid over the last 20 years. Much of it has gone to the dark green segment, HIV/AIDS, and to maternal, newborn and child health, purple segments. Much less has gone to health systems, which is the yellow segments that you can see here. And arguably, this is where the investment should be made, in line with the Alma Ata Declaration that Martin was talking about earlier. But in that list, under the SDGs, there's a list of disease categories, and health systems are somewhere down the bottom, with very variable indicators. I haven't heard that latest one that Martin was talking about. I don't hold out much hope for the post-2015 agenda in terms of health, therefore. And I would argue that we should be, instead of prioritising diseases, we should be prioritising people. We don't teach our medical students to prioritise diseases. We talk to them about serving the patients in their round with whatever disease they come to you with. Unfortunately, we replicated another perspective on the national, on the global level. And I would also want to shift the policy focus much more to the national level and what nation states decided on as the priorities, given their disease burden and health outcomes, and focus much more on stuff that Martin's doing, which is expanding citizens' rights to healthcare, because that's the primary driver of healthcare improvement in poor countries. Thank you very much.
Thank you both for those really interesting talks. We have time for one or two questions. So, yeah.
Thank you both for coming to speak to us today. My question has to do with Mr. Drewry's tenet for the health poverty action, which is justice, not charity, and the idea that nonprofits, or at least health poverty action, focuses more on the empowerment of people as opposed to administering care. my question is, should fewer nonprofits be focusing on the idea of charity and more on the idea of empowerment and empowering local communities? And what are some of the disadvantages to charity as a form of nonprofit work?
Can you hear, or shall I? Okay. Yeah, I mean, absolutely, I couldn't agree more. I think that, I mean, not only can charity never be the solution on the scale that is needed, it can absolutely be a bad thing. You know, I mean, one of the things that I was wanting to say, but time didn't allow, about the SDGs. You know, one of the fundamental weaknesses of it is that they're totally contradictory. Is on the one hand, they're talking about reducing inequality and bringing all being included. And yet, on the other hand, they talk about the solution being just this constant focus on growth. You know, as though that this obscenity of the richest in the world can continue to get richer, and that's not fine as long as the poorest rise up beyond their abject misery. And you know, and that's simply not practical. You know, there needs to be redistribution. You know, for any of these causes to succeed in a way that's anyway morally acceptable, there has to be redistribution, and that won't come without strong political pressure. And one of the great dangers, I always remember, I mentioned Claire Short earlier, but one example of it, when she was development minister on trade policy, which is a primary driver of global health, she was abysmal on trade. You know, out and out promoter of free trade rather than regulation to lift up the weakest traders and let them work their way out of poverty. She was appalling. And yet, once a year, for Fair Trade Fortnight, she'd get fantastic photographs eating a bar of Fair Trade chocolate and so forth. You know, or you know, giving to charity, doing something, and the thing is, it can just divert political pressure from the real causes. So, you know, absolutely, I think doing something is good. If but the most important thing is to strengthen the voice of the voters, and then especially what out of, because we basically divert pressure from the things that are causing their problems. That's no solidarity. You know, that's actually destructive.